Welcome to the Billionaire Lifestyle Podcast with your host, Emmett Muckles. Please visit iTunes, Stitcher, or emmettmuckles.com to listen to all the episodes for free.
Ladies and gentlemen, welcome to the Billionaire Lifestyle Podcast. This is your host, Emmett Muckles. Today I have a very special guest. I have the wonderful doctor, the self-proclaimed nerdy Indian girl, which is Rachna Patel. Dr. Rachna Patel. How are you?
I am doing well. How are you?
I am doing, I am really happy, ecstatic to have you here because I did such a search and it didn't even come back with straight results. I got referred to you from someone who saw my ad looking for someone related to medical marijuana and marijuana in general for the population because it's growing in such a rapid pace with several states. And I just don't understand why it's not legal, because anybody I've ever come across in the United States or anywhere else, I've not seen the ill effects of just smoking marijuana. As a matter of fact, I've seen where people are far more congenial and mellow versus people who drink alcohol, which is a legal drug. So, but that's enough of that. Let's start with you. Let's talk about your journey. How did you end up or get to the place where you are as becoming a medical marijuana expert?
Yeah, sure. So becoming a doctor, kind of obvious, right? Like, I'm a firstborn in an Indian family. That's a given. But thereafter, I was training in the area of emergency medicine, right? So now one of the reasons I went into emergency medicine is you're actually talking to a girl that grew up in the hood, right? Out in Jersey City, New Jersey. Yeah. And I felt like I was privileged. You know, nobody in my family did drugs. I had two parents that were very invested in me. I had an extended family that showered me with love. And at the age of 12, you know, my parents had saved up enough to purchase a home in one of it was an affluent white community. And what came with it, there, you know, the biggest draw of this community was the education, right? So this was the top ranking high school in all of New Jersey. And for my parents, you know, they couldn't give us much, but they wanted to give us a good education so that we can, you know, that's our ticket out.
Yep.
So one of the things that I've always desired is, how do I give back? Here I am, you know, I grew up in that community. I grew up privileged. And how do I take my privilege and give back? So I started in the area of emergency medicine because that's one of those fields where in America, there are laws in place that regardless of the person's ability to pay, a doctor in the emergency room has to see the patient no matter what.
Yeah.
So that was great, right? Now, the only thing was that as I was going through the training, you know, what you do in emergency medicine is you see a lot of pain, you know, whether it's head pain, stomach pain, back pain. And if there's no emergent cause, then typically what happens is that you tell the person to go follow up with your primary care doctor, and here's a script of pain medications to hold you over until you can see your doctor.
Ah, that's how that works.
Yeah, exactly. And that script is highly addictive, right? It has the potential to kill if someone overdosed on it. And so a lot of, you know, I felt like I was standing at a revolving door because, you know, here I was handing out these scripts for these highly addictive, potentially lethal pain medications. And guess what was happening, you know, on the other side of the revolving door? Patients were coming in saying that these medications aren't working, that they're experiencing side effects from them. And then I was in the unfortunate position of having to resuscitate patients that had overdosed on these medications, right? So here I was as a doctor really wanting to help people and solve problems in their lives. And instead, what I felt like was, I am creating a problem here. I am a part of the problem, not the solution.
So was this part of the opioid, you know, the introduction, was the same time period where you start to see the opioid epidemic start to flow into your life as a doctor as well?
So at that point in time, it wasn't brought to light, but it was certainly going on. right?
Right.
I can certainly tell you behind the scenes as a doctor, I was seeing it happen on a regular basis. It's just in the past couple of years that it's been brought to light. But things like this, it takes a while for it to build up, right? And then eventually come to light. So yeah, that's essentially what it was, is that, we're handing out these dangerous medications like candy.
Yeah.
And now we're seeing the consequences of it. And so a lot of times, I was too tired to get actual work done. And so I just surfed the internet, like any other insomniac. And one day I happened to be on Craigslist, and that's when I found an ad. I know. That's what I'm not.
What were you doing on Craigslist? What were you doing on Craigslist? Come on.
Okay. All right. Truthfully, I never gave up on my dumpster diving ways.
What do you mean dumpster diving? You're looking for deals?
Yeah. So yeah, that's what I was doing on Craigslist. And then I happened to just click on, they have a job section on there. So I just clicked on the medical and health section. And that's when I came across an ad that said medical marijuana doctor needed.
Oh.
And I had no idea before then that this field even existed. So
what year was this?
This was back in 2011.
Oh, okay.
Yeah. And marijuana was legalized in California for medical use back in 1996. But doctors were getting into trouble up until about 2004. So it was just a couple of years in until, doctors were protected from getting into any sort of trouble just for merely discussing medical marijuana.
Because it's a Scheduled 1 on on the federal level, and federal can supersede a state mandate, correct?
Correct. But then there was a court case that came out. I think it was called Walters or something like that. That basically said that both physicians and patients have a First Amendment right to discuss whatever treatment options are available to them, within wherever they are.
Right.
So that piqued my curiosity, started to do the research, right? Looked into research study upon research study. And a year later, what compelled me the most was medical marijuana's potential to treat chronic pain. We didn't have a good option in medicine. We still don't have good options in medicine as it stands to treat chronic pain. And this is a great alternative. And so by that time I was like, all right, I know what the books say, but how does this play out in real life? Right. You got to get the. And so that's when I signed up to work at a clinic so that I can start working with patients and gain clinical experience.
So what was that initial experience? Because, there are some clinics out here who are letting medical prescriptions flow like dollars in a strip club.
Yeah. And you're based where, in California?
I'm not. I'm near where you graduated from. I am near Chicago.
Oh, you are? Okay. So that's very interesting because that was the case and probably still is the case in California as well. These are basically mills that were churning out medical marijuana cards, right? They were just, doctors were just handing out cards to patients like candy. And so what's interesting is that at the clinic that I worked at, this was one of those clinics, whenever I actually took time with a patient, the receptionist would come barging in saying that, hey, you have to see the next patient. There were days when I saw 60 patients in a day. Okay, this isn't a matter of 7 hours. That is a lot.
Goodness.
Yeah, and so I had no choice. I mean,
I got to do the math on that.
It's about probably 5 to 7 minutes a patient. Probably no different than, I don't know, like Kaiser.
That's like ordering like takeout from McDonald's.
Yeah, through the drive-through.
Yes.
Exactly. So, really what I was trying to do was I was trying to learn the ropes, and I was out of there within like 10 months. I decided, okay, I can do this on my own, and I can do it with a greater level of integrity. So I gained enough capital to start my own practice. And I did that about, 10 to 12 months later.
So when you did your own practice, and this might be a little bit off topic, one of the biggest things for medical professionals to start their own practice is the insurance. Was the insurance for you higher or the same to open your practice?
Do you mean like malpractice insurance?
Yes.
Well, the thing is, because I'm not doing any invasive procedures, there's nothing like invasive involved. It's just giving information. It's actually, I don't know what it is in general for like other practices and whatnot.
Right.
So I don't have a good answer for that question.
That's fine.
Yeah. Yeah, but it is available for physicians who do practice in the area of medical marijuana.
Okay. So you worked your way up and you've
yeah,
got enough
and then
capital.
I started my own practice in 2014. I recently actually closed my practice because I took my practice now online. And I'm working now with people from all over the world because that's how much of a need there is for the work that I do.
But with your work, let's say, for instance, I'm in Indiana, which is a no-go state. This is like the Bible Belt of the North where I live. And they have just introduced CBD oil into the population here.
Sure.
But still, that may help some, but some other people may actually need medical marijuana or marijuana in general. I'm using medical as a term because, it helps so many different things for so many different people. What is the likelihood of it being taken off the Schedule 1 aspect of the federal level?
Well, it might be very likely because here's what's going on. There is a pharmaceutical company that has created a botanical extract, okay, of plants that they've grown. So it's no different than getting, like a tincture. Do you know what a tincture is?
Yes.
Yeah. So it's no different than getting a tincture from a dispensary, except if a pharmaceutical company can get it approved by the FDA then reschedules it, so it's only available by prescription. Okay?
Gotcha.
So I don't know how that's going to affect all the other, these recreational markets that have popped up. But that's one of the things that can happen because that's what this pharmaceutical company is doing.
So with that tincture, would that also include like vaping and things like that as well, or just is it drops? Hold on. Clarify your question for me. So, are
we talking about from the legal aspect?
No, I'm talking about from a legal aspect, the delivery method of the substance.
Yeah, gotcha. So it's not the delivery method that matters as much as the chemicals in whatever's created. So it's the chemicals that they're classifying as a class 1 substance.
Got you.
Right? So whatever form it comes in, it's not going to matter. If it has those chemicals, then, you have to obey, what's on the Controlled Substances Act.
Gotcha. So that's tetrahydrocannabinoids, which is what most of the legislation is focusing on. Is that what it is? Yeah.
So what's interesting is that there's been some highly confusing legal stuff going on recently, right? From the government's perspective. You have, I don't even know where to start or how to explain this. So basically, recently, the DEA clarified that we're not just talking about THC when it comes to marijuana. We're talking about all the different chemicals that it produces. And any extract that you make from it is considered a class 1 substance.
Is that including CBD oils as well?
It does include CBD, but interestingly enough, hemp. Okay, so the difference between hemp and marijuana, it's the same species of plant. It's Cannabis sativa L. The main difference between hemp and marijuana is that hemp has less than 0.3% THC in it by law. Okay? And then by default, marijuana, anything that constitutes marijuana, it has more than 0.3% THC in it. Okay?
Okay.
So interestingly enough, extracts of certain parts of the hemp plant are okay, are considered legal. But then extracts from other parts of the plant are not. And there's just a lot of sort of back and forth going on between the hemp industry and the government, in terms of what is allowed and what's not allowed. And there's also sort of vagueness in the law as well.
Of course, that's how they keep you confused and keep things, confusion is the best way to keep something in its place.
Yeah. Because then you can just point the finger, because you have the agricultural department involved, you have the DEA involved, you have the people who, I guess it's Congress who manages the Controlled Substances Act,
Yeah.
and then you have the FDA involved as well, right? So everybody's sort of, I don't know if there's enough communication going on between all of them to come to one consensus sort of thing.
So what have you seen? What was your aha moment when you said, wow, this stuff is really helping people? I mean, like, I know what I've been told, and I know what the, for lack of a better word, propaganda is about surrounding this substance. But I know you had to have a moment where you were like, whoa, it's not what I thought.
So based on the research, here's what I went in expecting. There was some research that showed that when people use marijuana with their opioids, not only did they get better pain relief, but they were able to reduce the doses of their opioids as well. And this is what I expected going in, when I was seeing the patients, that, okay, they're going to start to use the medical marijuana, and likely they're going to start reducing the doses of their opioids. But what I found was a lot of these patients that are typically resistant to conventional prescription medications, and by resistant, I mean, these therapies have failed them. They stop working at some point, or they just don't work, period. And they were they were coming off of these medications, and they were just using the medical marijuana to help manage their pain. And these are conditions such as fibromyalgia, we're talking about arthritis, where people kind of spin their wheels, looking for a solution to the problem, but they're not really coming upon a solution. And then they end up, taking a cocktail of medications at the end of the day, sort of throwing the kitchen sink at it, hoping that something will work. So that's what really, really took me aback, that it was like, okay, this has, like I said before, it has a lot of potential to treat chronic pain.
So did you actually begin to see where it was making a difference in physical people that you were involved with as far as your practice? Okay, so
what do you mean by that?
So, you did the research, but then you said, okay, I'm going to move forward with this. And then you see the physical progress in human beings that are coming to your practice, or that you have, who have reported, look, I've been on this for a while. They're coming to you, or switching doctors, or switching clinics.
Yes. Yeah. So not only physically, but emotionally as well. Because one of the other things that I commonly treat is anxiety. And, when you have the highly anxious patient come into your office, and then a year later, after they've been on medical marijuana treatment, you notice a huge difference in just their general composure. They're more calm, they're more relaxed. We talk about things like, okay, some of them may have experienced panic attacks. They report that there's a reduction in the panic attacks that they've experienced. It has an impact on their relationships. They're not as irritable or agitated, right? Because anxiety can do that.
Yeah.
It helps with their productivity because they're not sort of incapacitated by the anxiety. Helps with their sleep. So it can sort of, it just, it goes on and affects all sorts of areas of their lives. I've had patients, I get elderly patients with arthritis, and they're like, Dr. Patel, I was able to pick up my grandchild.
Really?
That's huge, right? Yeah. When you're not able to pick up your grandchild because you're experiencing pain, that sort of hurts you at an emotional level as well. It's not just physical pain, but now it's emotional pain as well. Or even something as simple as buttoning your shirt.
Oh, yeah.
Or unscrewing a jar, right? You're now, we all strive to be independent, and to be dependent on somebody for little things like this, again, that can have an emotional impact on a person's life. So all these things, what I see is I'm fulfilling my life's purpose, which is impacting change in people's lives when I see things like this.
That's so awesome. That is so very awesome. So I have this question for you, because I have known people who have partaken in marijuana since I was a child. I mean, family members, friends, who are older than me. And I've also known people who, their recreation of choice was alcohol. what I've seen overwhelmingly is people who drink alcohol, and it is non-Schedule 1, can be more of people who smoke marijuana. Is there something to this? Is there some kind of chemical? There has to be something.
Yeah, I heard you.
Okay.
So you said that people who
people who drink,
people who consume alcohol, yeah.
People who drink have far worse personalities than people who smoke marijuana.
Yeah, and they get belligerent. Yeah. So again, it's that whole. So alcohol is a depressant, right, on the system, whereas marijuana, in terms of its impact, like I said, it's what's called an anxiolytic. Okay, so anxio means anxiety, lytic means break. It breaks anxiety.
Really?
Right? Yeah. So like these patients that I was talking about who experience anxiety. They're less irritated, they're less agitated, and it's because of this effect that the marijuana has. Basically, what marijuana does is that it helps in one way or another. We don't know exactly how, but in one way or another, it helps to increase serotonin levels, and that's what's helping to reduce that anxiety that they experience. So that's the reason why you find that when whoever uses marijuana. They're not aggressive. They're not, when it comes to anger, they're not as angry.
Yeah. Yeah. And I hate to put it this way, but, we can attribute the progressive movement towards the decriminalization of marijuana to cancer patients, because that's where I first started hearing of it becoming legal and accessible, was for patients going through chemo, where it would depress the nausea, it would increase their appetite, and allow them to, manage this process so much easier. Have you been working with individuals who are on chemo or who have had similar experiences to help them move forward?
Yeah, certainly. For like you mentioned, right? So patients who are undergoing chemotherapy, they experience nausea, they experience vomiting, they experience lack of appetite. A lot of these patients with cancer also experience a lot of pain, whether it's because of the physical cancer itself, or it's from having chemotherapy, right? It can affect your nerves, and then you have residual pain from that. So those are the main reasons why. Now, the other thing is also that oftentimes these patients unfortunately end up in hospice care. And at that point, the family's just looking to make them feel more comfortable. And, often these patients are given morphine, which is an opioid. And so, they'll combine the use of the medical marijuana with the morphine to help make them feel more comfortable, reducing the need for the morphine ultimately.
You said that you've closed down your brick and mortar practice to be more online. Help me to understand that process. What was your decision to say, I need to step away from this where I am accessible to this small group, but it's physical individuals, to be able to do the greater good help? What was that process for you? What was that decision like?
It came out of a demand. It came out of a demand of calls that I was getting at my office from people all over the world, right? I had people from England and from Argentina calling me and being like, Dr. Patel, can you help me? And at that point, I didn't have sort of a system and a process set up to help them. And when people are reaching out to you for help as a doctor, you want to do everything within your means possible to help them. So that, and then also people reaching out to me by email, by messages on my social media profiles. So it was just out of just a natural demand that, and again, like I said, my goal is to impact as many lives as possible with this, right?
Yep. So, and here's why I want to ask you this question, because you say you move your practice from a brick and mortar physical presence to an online presence, because I think it was back in 2003, Tommy Chong, who was making paraphernalia for the consumption of marijuana, was arrested because he was shipping paraphernalia across state lines. So what is it that you do in the virtual world that you that expands versus having a brick and mortar?
Sure. So, couple different things, right? So, I have protocols that I've created that are video recorded. Basically, they're by medical conditions. So for instance, if somebody has arthritis pain, then they can go ahead and purchase that, and it will walk them through how to safely use medical marijuana for arthritis pain. Or if they have fibromyalgia, they can purchase that, and it'll walk them through how to use the medical marijuana for fibromyalgia. So because my hours are limited, right? My time is limited. I can only work reasonably 8 to 10 hours in a day, and I can only see so many people in that period of time. And so that's one of the things that I'm doing. I'm also working on educating other physicians as well. So I sort of closed my office and then went a little bit nomad so that I can travel the country and educate physicians at conferences and whatnot, at meetings, about medical marijuana. And actually, that was very interesting. I was a little bit nervous about that. Mm-hmm. Physicians in general tend to be conservative, and there's this, like you mentioned before, the clinics that you were talking about, there's sort of a reputation that medical marijuana doctors have, right?
Yeah.
And so I didn't know what I would encounter, but what was incredible was how engaged these doctors were. And really what's sort of coming to head is that these doctors have no choice but to educate themselves or get educated about medical marijuana because their patients are coming to them with questions.
Right.
And they don't necessarily have answers. So they were incredibly engaged. I have the experience to really the books can say one thing, like I mentioned before, but when you have the clinical experience and how it plays out in real life, that's the information that other doctors are looking for. So that's another way of reaching even more people and impacting more lives.
So that was the one thing I was going to ask you. So are you doing workshops, independent workshops, that are not associated with medical conferences where you can address the direct public? And what products do you have, and how can people reach you?
Sure. So I'm not doing workshops, right? I do put out information on my YouTube channel, and that's where I answer commonly asked questions that people have. So that I do about once a week. And then for physicians, I am eventually planning on creating a group. And then in terms of products, I am working on creating a line of products, formulating basically hemp-based products for folks to purchase. So these are all sort of projects that are in the works. So at this point, the way to work with me is either to set up a consult or to purchase the Patel protocol.
And what's your website?
Website is my name, www.drdrrachna, RACHNA, Patel, PATEL.com.
And you have to have a Facebook and a LinkedIn. I know you do.
Oh, yeah, I do actually. And Facebook is just facebook.com/Dr., the whole word spelled out, Rachna Patel. And then LinkedIn is Dr. abbreviated, LinkedIn.com/Dr. abbreviated Rachna Patel.
Awesome. So if you could go back like 10 years, make it 11 years.
Okay.
And close your eyes. We're going to do an exercise.
Okay.
So you're sitting, let's say you're doing your residency, right? You're stressed out, and you have a moment where you can just chill out for one whole day, and you're sitting on your couch, and you're like, oh, thanks. And all of a sudden you hear a doorbell ring. And then you go to the door, right? And you actually see someone that you know, and that person is you. And it's your 17-year-old self. What would you tell yourself?
Relax. I'm just, the thing is that I'm an overachiever. I wake up every day challenging myself that, okay, what are you going to achieve today? So I'm not a materialistic person. I don't work to to achieve material things. But I work for two reasons. One is I know what my potential is and I want to achieve that potential, right? And that in and of itself can cause quite a bit of anxiety.
Yeah.
And then I've sort of handed myself this purpose, which can weigh on you, right? This purpose of impacting as many lives as possible. And so, just enjoying the journey. And yeah, that's what I would tell myself.
Well, very good. Well, Dr. Patel, I want to thank you so much. You are a value to me and you are a value to the public. So whatever you're doing, keep doing it and do more of it. And thank you.
I appreciate that.
And thank you for being on the Billionaire Lifestyle Podcast.
Yeah, of course.
All right, ladies and gentlemen, if you need some information, you know where to get it now. Here's what I say at every close of the show in some variational form. Remember, guys, we are human beings on this planet. All of us. We're not separated. We are all from the same stuff. If you really get down to it, and we're not even going to the smallest level, we're all made of this energy compilation that we've defined as the atom. Like in the Bible, it started with Adam. Ha! Got you on that one. But anyway, what I need you to do is really hone on yourself. I need you to appreciate yourself. And if you can't appreciate yourself, I need you to just take some time. Like I said, when you get out the shower, you get out the bathtub, you're alone, go to the mirror, drop the towel, spread your arms, and look at yourself. Look at that. It took 2 cells to come together to make you. And then 30 days after that successful encounter, you were a billionaire. How do I know? Just do the math. Just do 2 squared to the 30 point. You know what I mean. But you were a billionaire and you kept compounding and growing and you're a special individual. I'm going to give you more evidence. So there's this thing in the middle of your face that brings life into you every moment of the day, because if you stop using that, your life would cease. But next to that canal that brings the precious air into your body are the 2 galaxies, or how do I want to say it? They remind you of galaxies. As above, so below. We are fractals of the bigger picture. Realize how you're connected to everybody, connected to everything, and how wonderful you are. So when you know that you're just that precious and you see another entity coming towards you that has those same or similar attributes, realize how precious that life is. And don't prejudge it. That means no prejudice. Treat it with love, treat it with respect, and go in peace. Till next time, love you all. Peace. Thank you.